Good evening, everybody. Good evening, everyone, and welcome to another episode of Affinity's COVID-19 webinar series. I would like to begin by respectfully acknowledging the Gadigal of the Eora Nation, the traditional custodians of this land. We pay our respects to their elders past, present, and future, and to all the descendants who have cared for this place since creation. We also honour all other Aboriginal and Torres Strait Islander peoples who are joining us today. My name is Walangari Kandawara. I come from the Aranda and Lurija peoples of Central Australia. I am honoured and delighted to be part of this wonderful series of Ramadan conversations. My aim in life, like all Aboriginal First Nations peoples, is to educate and share our magnificent history and our Jukurba to all Australians and the world. Jukurba and Alchira are very powerful words in Aboriginal culture, and when you begin to understand what they mean, your life and those around you change forever. This is what my elders have taught me, and that is what I want to share with you all tonight. It is my pleasure to say that I'm also a member of Affinity's Advisory Board, and I hope to contribute much more in the future, God willing. For those of you joining us tonight for the first time, let me briefly introduce you to Affinity Intercultural Foundation. Affinity was formed by a group of young Muslim Australians in the year 2000. Affinity's aim is to promote multiculturalism and foster intercultural and interfaith dialogue by building bridges between different groups in society. The impact of COVID-19 has affected us as a global community. Nonetheless, Affinity has decided to continue with their events online. The first of these programs began in the month of Ramadan with over 27 daily episodes of Ramadan conversations with facilitator, former ABC veteran, broadcaster John Cleary and TV presenter George Danikian, as well as many other distinguished co-hosts, guests, and musicians joining, both nationally and internationally. Let's look at the highlight video.
Hello there, and welcome to Ramadan Conversations. We're all in this together.
Yes, fasting is month of sharing, and not just for Muslims as well as non-Muslims.
The very big question.
Based information.
And Affinity was extremely good group because it was focusing not on the religious differences, but at what is uniting us.
We're all living.
How do we thrive within this COVID-19 environment?
It's a community mission and everyone has a role to play.
We'll be much happier.
Big cracks that are
Can I pay tribute to Affinity Intercultural Foundation for your work throughout the community?
I think after a week of my cooking and my wife's cooking, my kids are looking forward to their grandma's cooking.
I'm really proud to say that on the whole, I think as Australians, we've kept our values intact.
And disinformation.
There is a very important correlation between controlling media and the quality of democracy.
Fake journalism.
It didn't become ugly. We held together. And Affinity is part of that spirit and part of that success.
As bystanders,
I'm always inspired by the efforts of Affinity, not just around Ramadan, but certainly then, their dinners, their iftars.
That they desire and be part of all of that is to go for it.
have met with
Of COVID-19.
I want to thank the Muslim community right across Australia for everything you have been doing and the great example you have been setting and the leadership provided in your community.
As is possible.
Make or break year.
Balancing act.
The duty to reflect
on the universe and as a book to read.
Cultural competency.
Affinity is part of the furniture now, as far as Australian multiculturalism is concerned.
What's important, but also how we're going to meet future challenges.
Is somewhat different.
Potential for a blessing.
And surely that's a Muslim and a Christian and a Judaic value. A value of collectivity.
The Nobel Peace Prize
is that when we work to complement one another, not the fact that one is better or should be ahead of the other.
More tenuous.
Through meaningful engagement. This very program is just one example.
To weather the storm.
This kind of thing.
1,000 meals a day.
I can't stress how important iftar dinners and sharing and understanding of Islam has been.
Go Cats!
Follow him for the day.
The symptoms of it.
The fake news
have been established, saying that religiosity can help people to overcome challenges.
Being Australian,
there's a lot of good in there.
We work for each other and work with each other.
Muslim fans.
COVID-19 has stressed the need for people to understand each other and to come together.
How to think.
Privacy issues.
To use music.
And we would like to give a Roman taste to dialogue and mutual understanding.
Import the interfaith dialogue in Rome and in Italy at the moment.
Prayer is the joining in cosmic worship.
But that is the one thing that I have missed.
Subhanallah, Subhanallah.
The night of revelation, it is both a Jewish and Muslim practice for people to stay up all night.
A bit like Martin Luther King Jr. said, injustice anywhere is a threat to justice everywhere.
Faith actually has a very positive role to play in making a society very humane.
To love others.
And make them feel welcome.
Let's actually rebuild something better.
I wanted peace in my heart, and I was in peace, and the result of peace was that, I forgave.
I really enjoyed learning about Ramadan, and I'm really, really looking forward to hopefully next year.
Who are we?
The great work that you do.
The sort of approach that Affinity itself has taken. One in which you seek to have a broader understanding of what you believe.
Consequences for our actions.
Actually create.
But there's no going back.
There are no barriers between science and faith. They complement one another.
Breaking the ice and building confidence has been really productive.
Believe in different things, you can have a different culture, different skin color, but sports bring people together.
I'm just extending my hand to the Australian Muslim community and demonstrating that we are the same.
This particular conversation about during Ramadan is one that is really, really important.
COVID-19 is an opportunity.
Which I think Affinity and other dialogue centres in our nation have really contributed to.
To find what common values we have, goals, and so it just strengthens us.
The interfaith.
Our culture is based on love and respect.
Which maybe will open the door and create some trust and build a bridge where we can start to talk about the ways that we're different from each other.
Through fasting, we are trying to empathize other people who cannot find what to eat at other times of the year. Empathy.
This is the last of our Ramadan conversations for 2020. I look forward to catching up again soon. Ramadan Mubarak.
More of these episodes are available to watch on Affinity's YouTube. Tonight's webinar episode is in collaboration with Multicultural New South Wales. Like Affinity, Multicultural New South Wales promotes community harmony and social cohesion in one of the most culturally diverse states in the world. Without further ado, I would now like to introduce tonight's facilitator, Philippa McDonald. Philippa is a senior reporter at ABC News New South Wales and is currently covering bushfire recovery as well as the impact of the coronavirus on regional communities. Her career has been built on breaking news and analysis on the biggest stories of our time. She has been at the centre of the media's coverage of Australia's worst bushfires, political upheaval, family violence, the disappearance of MH370, terrorist attacks, earthquakes, mine disasters, and coups. From medical breakthroughs to the billing practices of internationally renowned surgeons, to the hunt for a serial killer, to the Royal Commission, which revealed how the nation's most trusted institutions fail children. Welcome, Philippa.
Thank you very much, Uncle Wanangari, for your warm introduction. It's a pleasure to be here tonight. I would also like to acknowledge the traditional custodians of the land in which we live, learn and work, and pay our respect to all Aboriginal elders and to their families, past, present, and emerging, and to acknowledge today's Aboriginal community who are the custodians of this land. Tonight we will be discussing faith communities and interfaith cooperation during COVID-19. With restrictions put in place to keep communities safe at places of worship, faith leaders and religious charities have had to find innovative ways to provide spiritual, psychosocial and welfare support for their communities. Our distinguished guests this evening are Dr Jan Fizzell and Joseph La Posta. Dr Jan is a senior medical advisor who has worked in the office of the Chief Health Officer since 2006. Dr Jan has extensive experience in pandemic planning and response, including a key role in managing the 2009 swine flu outbreak and supporting the development of the New South Wales Health Influenza Pandemic Plan. Dr Jan has become a public face of New South Wales COVID-19 response with her popular daily Ask Jan sessions on Facebook Live and regular engagement with the multicultural and faith communities of New South Wales. Joseph La Posta is a respected leader in the government, sport and corporate sectors of New South Wales. He has been the CEO of Multicultural New South Wales since January 2019. His aim is to ensure that in New South Wales, diversity remains our strongest asset and that all communities feel supported. Since the outset of the pandemic, Joseph and Dr Jan have actively engaged some of the most senior faith leaders in the state to message out and share ideas on how to stop the spread. Now, before we begin our conversation, I'd like to inform our listeners to write down their questions in the chat box using the hashtag AskInfinity, and we'll try to answer them in the allocated Q&A session at the end. First, let's hear some of our video questions. Dr. Patrick McInerney, Director of Columban Centre for Christian Muslim Relations.
Relations in Blacktown. My question is this: how can we be proactive? How can we live and work together in ways that not only deal with the immediate consequences of the pandemic, but prepare us for living and working in closer collaboration into the future? How can we prepare now for a post-COVID way of life? But even more importantly, to how we can live and collaborate in such a way now that such a thing as COVID will never happen again.
Dr. Jan, can I hear your thoughts? And then, Joseph, I'd like you to add yours.
So I think one of the most positive things that has come from this pandemic has been the building of bridges between different communities, different people, brought together by what has been, internationally a tragedy, but has brought out a lot of the best of people's response, their responsibilities towards each other, their kindness towards each other, and their ability to share to some extent the difficulties that we've all been facing, such that, those trite phrases like we're all in this together actually are quite true. And so one of the challenges is, though, bringing people together. And I think that's where this partnership with Multicultural New South Wales has really helped health, as far as instead of us just being people who say, don't do this, do that. It actually allows us to have a dialogue about why are we asking things of people? Why are we asking for things that are fundamental and core to people's belief to be practiced in a different way and to change how we're doing things? So that's the first part of the question. What's the opportunity been? And I'm really hoping that this sort of work that we've built up continues, because there'll be other challenges that we face into the future. Even if we're lucky enough to come through COVID in the next 12 months with a vaccine or some other, wonderful thing that changes things. But I think the thing is that we need to remember in our post-COVID world that we have been able to cooperate, care, look after each other, so that we keep this sort of dialogue going, so that when health asks something of people, we've got those channels open. It won't be the first challenge, it won't be the last challenge that we have, but if we keep these avenues of speaking and talking and discussing, and then we're in a much better place as we move forward.
So Dr. Jan's really talking about trust as well, Joseph. Can I get your thoughts there, please?
Well, I'll say this, Philippa. Father Patrick knows the answer to that question because he lives and breathes it every single day. It's fundamentally about trust, but it's also equally importantly about building and nurturing social capital. And I think one of the challenges that we've seen in modern society is that we're constantly looking for, an outcome or a win on certain things. And I think at times we can be leveraging off yesterday's social capital rather than building tomorrow's social capital. And what COVID's done is it's given everyone, the whole of society, a really clear purpose to engage with each other, and then to think about how we can come together to solve different elements of a common problem. And I think my hope is, off the back of this pandemic, that we never lose that sense of connectivity around trying to solve common problems. My thinking for a society going forward is the common problem is the elements of inclusion. How can everyone feel a right to belong to a part of every single societal issue? How can we give those people a voice? How can we look at these issues united? And then how can we go away and try and solve them together?
Thank you. Well, our second video was from Zia Ahmad, the Editor-in-Chief of the Australian Muslim Times A Must. Let's hear from him.
Hello, this is Zia Ahmad, Editor-in-Chief of Australasian Muslim Times A Must. That was indeed an excellent webinar. We have learned a lot. Just a quick question from Joseph. Look, we have been receiving your regular statements and instructions regarding coping with COVID-19 pandemic. What do you think has been the cooperation received from the Muslim community, especially the people who have been attending mosques and all that? You know that we had a couple of major festivals during the pandemic, and there has not been any reports of infection through the mosques. What are your comments regarding these?
Can I just say that Ziad is onto something, absolutely, and I couldn't concur with him more. I think the Muslim community and their leadership in Australia, but particularly in New South Wales, has been exemplary. I think that if you look at the rates of infection and transmission in Australians of Muslim faith, and particularly Australians in New South Wales of Muslim faith, they're some of the lowest transition and infection rates in the world. And I think that's something that as a society we should be incredibly proud of. It's taken incredibly strong and dedicated leadership from all of our leaders, but particularly organisations like the Australian National Imams Council and others. So even in Ramadan, when the health requirements in New South Wales were relaxed somewhat to allow a certain number of people to attend places of worship, the Australian Imams Council and ANIC ensured that their mosques stayed closed because they were really concerned during Ramadan that by opening up the mosques it would send a message that was counterproductive to the community to say, come to practice your faith. And the great concern was not necessarily what happened within the mosques, but what happened around the mosques at entry and exit points, people hugging each other, people feeling a sense of relief to see each other in that human interaction. And I have to admire and congratulate and commend the Muslim Australian community for the way that they've continued to lead their communities throughout this pandemic.
And Joseph, I might just pipe in here. What kind of response did you get from the imams when you said close the mosque? I mean, this is unheard of.
Yeah, Philippa, it was really interesting. I spoke to a colleague in the New South Wales government who is a practicing Muslim, and he said, it doesn't matter what the Premier of New South Wales says to my dad, it matters what our Imam says to my dad. And he said, if the Imam says that the mosque is closed and not to go and pray, then he will listen. But the reality of the situation is, in our society, it's the importance of government working collaboratively with our community and our religious leaders that leads to the outcomes that we can deliver. It's not any one of those sectors working alone. And I think the other thing that we have to recognise is for some of these places of worship, we're asking them to change practices that have been in place for over 2,000 years. And I don't think that can ever be lost on people. We've asked mosques to close down for the first time in 2,000 years. And their leadership during this pandemic has been nothing short of, in my opinion, outstanding.
I might bring you in here, Dr. Jan, on that.
Oh, look, so I just cannot tell you how amazing and how wonderful the work that we've been able to do in partnership with Multicultural New South Wales, bringing us together with the Muslim community, where we could explain the different changes that were taking place, how things were changing, why things were changing, getting ready to reopen, and then when things had to become restricted again and why these things were happening. So that people didn't just get an announcement from the government. They actually had the chance to engage, and so they were able to ask questions of health. They were able to say, why are you asking this of us? And we had an opportunity to explain what we were doing and why we were doing it. And I hope that that has helped. I know it's been a terrible time for so many people when we have been asking these extraordinary efforts on people to change things, and to have the opportunity to explain why, to be able to help when people had questions, when things weren't clear. It's been an amazing opportunity to be able to engage with so many people in this way, to be able to hopefully make what has been a very difficult and trying time that little bit easier.
Can you both give me some idea and give our audience some idea of what it's meant in practice? How have you been engaging in people? Give us some idea of what you've been doing, the sort of boots on the ground, sort of coalface engagement.
Go on, Dr. Jan.
Joseph.
Okay, I'm going first then. Philippa, thanks. Look, there's probably been a number of different pillars. So first and foremost, it's been activating a lot of the existing frameworks that we have to engage with people throughout Multicultural New South Wales. So we have an interfaith forum. I have always thought that forum's been reasonably popular. In COVID times, that forum's popularity has gone through the roof. There is not a forum that the minister does not attend, nor is there a forum that Dr. Jan or others from the government sector don't attend. It's an incredibly important forum to be able to listen to the community, listen to their concerns, listen to their needs, listen to see what's working and, more importantly, what's not working, and think about how we nuance adjust, tailor our response. I think the other thing that's not lost is in normal government times, some of the speed at which we are making decisions or disseminating or circulating information can take weeks or months. In COVID times, that can take minutes or at worst hours. So the speed at which the government is operating at the moment in terms of looking at reform, legislation, rules, regulations, it is unprecedented in terms of how quickly we're moving through some of these things. And I come back to Patrick's earlier question. I think it's actually setting a new gold star for how government needs to work and the speed at which government needs to sort of sustain itself. So that's my hope for one of the outcomes from COVID as well is, friendships and bonds that people like Dr. Jan and I have built during these really troubling times will now be long-standing into any issue that comes up in the future, whether it's issues around bushfires, whether it's issues around attacks or anything else. The learnings from COVID will be able to carry forward.
Dr. Jan, can I ask you, is there anything that struck you that's really working that has surprised you? Is there anything that you sort of thought, I didn't think that would be so successful?
Oh, look, I think I'm super excited that we get the feedback from the community. Whenever we step 1 foot wrong, we hear it really fast, and it's so successful because it means we can affect that change really quickly. So if something's unclear, if something doesn't make sense, if it just doesn't, if something's not working, we can get that change happening so that something does work for people. So if somebody says to me, look, this just, lovely idea, health, that's just not going to happen, it does mean that we can actually get that feedback very, very quickly. And it also means, though, that if someone needs an answer from health, they've got a channel to try and come and get some sort of guidance, so that whilst I haven't reviewed every COVID safe plan of every place of worship in New South Wales, we have been able to sort of get that sort of information in. But also because we've been able to have so many people engaged through these forums, it means that I explain once to 50, 100 people, and then they can go and explain to another 100 people. So it is just a wonderful way for us to be able to explain the reasoning behind what we're doing. And the fact that people keep coming, I'm always amazed that, if Joseph calls the session together, we have many, 40, 50 people coming to listen. This is what we're doing. This is why we're doing it. And it's just wonderful because then they disseminate that through their network. So they don't just have the piece of paper from the Chief Health Officer saying, please do these things. They have the ability to say, and why has the Chief Health Officer asked us to do these things? And I think that's been really powerful as far as being able to help people make sense. Because let's face it, it's been a difficult, puzzling time. Things change quickly. And so being able to explain to people why we're doing things, or why we've asked things of people, or why we see things as a risk. So things that people take for granted, like, going out of a service together is a very common thing. But we've had to ask people to think very carefully about that is actually one of the highest risk activities you can do when you attend a place of worship. So I think it's really trying to explain to people why we're concerned about different things. But Joseph's also had an incredible team. Yeah, singing. Which is one of the hardest things we've had to ask of people. And it's been an absolute tragedy because this is one of the things that gives people such joy and such a sense of community. And to ask people to not do this thing that is such an important part of so many religions and so much custom, and to ask people to change this, it's just heartbreaking for us to ask it of people. But when we explain that actually we are seeing places of worship as a place of transmission, people who are devout, who are caring, who are trying to do all the right things, and then, to see people struck down from singing together, it's just a tragedy. And so if we get the chance to explain that we're actually not just, we're not the fun police, we're not there to try and stop people from doing things, except for the things that are very dangerous at the moment, and trying to explain that this is actually a really dangerous activity at the moment, and that we are seeing spread in places of worship. We are seeing people die as a consequence of being somewhere that is so important and so precious to them. It's just terrible. And so
and we did see that recently, yes. And we did see that recently. So How did the communication work there to tackle something that was, in the end, resulted in the death of someone? But how did you communicate there in Western Sydney at a church and the funerals, etc.? How were you able to try and tackle what was a very difficult situation?
So I think this is where this partnership has worked really, really well, because as soon as we started to see any spread to do with funerals, we said, Joseph, can you please help us? We need to tell people this is a really dangerous thing that we're seeing happening here. We understand why people want to be together. We understand that at a funeral, people want to comfort each other. We understand all of this, but we really need to explain to people how very dangerous it is. And by the next day, we had a forum with the religious leaders to explain the transmission events that we were seeing, to explain why we were so concerned about funerals, and not just that we were trying to reduce numbers to, do something to make contact tracing easy for us, for example, which is, I think, sometimes what people think that we're saying, but that we're actually really, the reason why people become contacts is because they're at high risk of getting COVID, and that's what we were trying to avoid. So it was really hard, though, for people, because there's an element of faith that if you're practicing your faith, that bad things should not happen to you while you're engaged in that particular process. And I think that's been a very, very hard message to balance to people, that people are not necessarily doing something bad. In fact, they're often doing good things for other people, doing things that they've done for years and years and years. But we know that at the moment that it's unsafe to do things the way we have done it, and we need to change. And we'll keep working with the community. We'll keep hoping for the vaccine. We'll keep helping people come together safely wherever we can. But the problem is, wherever we have COVID in the international community, even if we, significantly suppress it so we don't have community transmission here, you can see it re-emerge. Look at poor New Zealand, who'd done such an amazing job after such sacrifices. And so we do need to make sure that people don't take what we're getting to for granted.
Well, I think now's a good time.
Talk about it. Yeah. I was just going to say, Joseph may also have his end of that story too.
Yeah, I think, Philippa, one of the things that was really challenging at the start of COVID was actually asking these places of worship to shut down. And so when you're saying to them, you now need to close the doors of your church or your mosque, and that we can't reopen until, or your temple, wherever, and we can't reopen until it's been demonstrated to us that you've got appropriate safety plans and all of these things, and, cleaning regimes, then inevitably, I only need to take you back 3 or 4 months. There was no hand sanitizer. There was no COVID safety plans. So during those times, we were able to work with the community to be able to get them access to the essential PPE equipment that they needed, access to the sanitizers that they needed, support them with the COVID safety plans so that they were in line with best practice, work collaboratively with them. But I think one of the things that Jan touched on is at Multicultural New South Wales, there's a couple of members of our team, particularly Malcolm and Tita, who have had relationships with these communities for over 10 years. So they've stood shoulder to shoulder with these communities after what happened at the Martin Place siege, after what happened at Christchurch, after what's happened in various different, the San Diego synagogue attack. So they've stood shoulder to shoulder and side by side with these people during incredibly difficult times. And now in this pandemic time, when it relates to us and to our places of worship and to our communities, that social bond and that social capital has been there to be able to ask them to do the hard things. And then obviously wherever we can, in terms of rewarding them with giving them a heads up that things are going to change so they can then let their parishioners know a day before everyone else, has been incredibly useful and helpful as well. So there's a strong mutual bond, I think, between government and the religious leaders that we have to continue to nourish regardless of what this pandemic throws us and whatever happens afterwards.
Well, now might be a good time to just have a little bit of reflection and hear from Uncle for a special didgeridoo blessing. And I'd like to invite back Uncle Walangari. Uncle Walangari.
Hello. How are you, Philippa? All good? So I'm going to just quickly play this wonderful iconic instrument of ours, the didgeridoo. We actually call it the yiraki, and it comes from Arnhem Land, and of course, a lot of people from the Muslim faith who saw the young Muslim men travel up to Arnhem Land and meet a wonderful man, an elder called Jalu, who spoke about our stories of Allah. So I just want to bring back the Yiriki and give a little blessing to everybody. So once again, take care, God bless, and may you all be safe and well from this terrible coronavirus. So I'm just going to play this wonderful instrument, the Yiriki. I hope you like it. And there we go. Thank you very much, everybody. God bless. Take care.
Thank you, Uncle. Well, that was beautiful from Uncle Wangari, and that brings us to some of the other sort of challenging conversations we need to have. And we have another question by way of video from Gawain Powell Davies, the chair of the Buddhist Council of New South Wales.
I'm Gawain Powell Davies from the Buddhist Council of New South Wales. I found the Religious Communities Forum incredibly helpful thus far during the pandemic, and I wonder what you think we can do to help during the recovery.
Yeah.
Well, isn't it lovely to hear that word recovery? We're not quite there yet, are we, Dr. Jan?
Every so often I think we're so close, but I think the thing is a recovery starts when the response starts. We need to start thinking about how we look as we keep going, and we take those steps to think about what does this mean, not just tomorrow, not just next week, but what are we learning that will keep us in good stead for the weeks and years to come.
And Joseph, your thoughts on recovery and maybe some of the steps that can be taken by the interfaith community, which is coming together to be such a close-knit force in trying to win this battle.
Yeah, thanks, Philippa. I think Gawain's question is absolutely spot on. And the learning from me from this pandemic is I've always had respect for religious communities and the different religious communities. Over 146 different religions practice in New South Wales alone. But one of the things that has become incredibly powerful and important, not just for me, not just for my team, but I think a key learning for the New South Wales government overall, is the sheer humanitarian load that so many of our different interfaith communities and our religious leaders shoulder. And that might be checking in with the elderly, that might be delivering emergency food hampers and packages to families, that might be providing shelter or food for temporary visa holders or asylum seekers, or even some of their own parishioners that have become homeless, not even their own parishioners, but others that are in need. The donations of clothes, the donations of staples like rice and wheat and so many other things that have been essential to provide people affordable cooking options. We've been overwhelmed. And so Gawain's comment is so timely because I think it's our role as government to continue to empower those communities through, modest amounts of support and funding and grants and all of these things to keep doing the exceptional work that they're doing. And I think the other critical thing that Jan touched on before is for our religious communities to know that your feedback is very much heard and listened to. So the feedback that can come from these sessions, and not just these sessions, but regional advisory councils, so many of the different other opportunities that Multicultural New South Wales engages with people. Even the other day, we had a forum about trying to understand the ramifications of COVID on women, particularly women in the household, and all of the challenges around family violence, domestic violence, challenges around empowerment, challenges around security and safety. That is being heard right now in such a clear and concise manner. And so all of that feedback from all of our different community groups, please know, because of the speed at the way government's working, that we're trying to provide that almost immediate support. Now, that's been critical during the phase of the response, and it will be even more important during the phase of recovery. So I don't have all the answers, Gawain, but very keen to work with you and to listen and to understand any ideas that you or others from your Buddhist community can provide to us to make sure that we get it right as whatever part of our response is.
And Dr. Jan, where do you see the areas of greatest need in that recovery phase, which you say is already underway, where there are some really high needs because people are suffering a great deal even without getting the virus?
So I think that rebuilding of connections between people, that people who've gone and shielded themselves from others, people who've withdrawn from fear, people who have lost their jobs, young people who've become disconnected from their friends because everyone's moved in different directions during this time, the mental health burden of isolation and uncertainty and fear for loved ones, fear for others. We just cannot underestimate the burden that this has had beyond a pure infectious disease. So I think this is one of those times where we need to make sure that we're continuing to support people as they come back to their churches, as they come back to their mosques, as they come back to their temples, to feel comfortable and safe when they come back, because I know some people are still not back face-to-face worshipping because they are concerned about the fact that the virus is still there. And that means that they're cut off from some of their most social connections. For some people, the mosque, the church is their place of refuge, it's their place of strength. And when that place is unavailable, we saw some questions when the mosque is a place as a haven from domestic violence and the mosque is not open. How can we help women get the services that they would normally get through the mosque? How can we help make sure that people are aware of where the mental health supports are, where they would normally get that support and social connection through a church group, for example, that may not be meeting? How do we help replace some of the volunteers who've withdrawn because they're feeling older and vulnerable? And how do we help younger people who are kind and willing and have done so much sacrifice already during this pandemic to step in and start picking up some of that burden that older people have been shouldering for so long, without overburdening our young people who are also having a terrible time. It is a very hard time to be a young adult with COVID-19. All the wonderful things that you are usually used to being with, whether it's your youth group, whether it's being with your friends, whether it's singing together, partying together, being at work, being at university, being, able to follow your trade, all of the things that are normal and so important for young adults. We're asking a huge amount of the older community. We're asking a lot of the younger community. There's nobody who, is getting off lightly from this pandemic. And I think this is something that we just need to acknowledge, that as we come out the other side, that we've actually got a lot of bridges to build back again. And they may be better bridges, they may be new bridges, they may be exciting ways that we've learnt to engage and be with each other that we haven't been used to, because we've had to get used to out of necessity. So it's not all bad, but I think the key thing is that we've got to make sure that we don't neglect it. Just because we get out the other side doesn't mean that all the things that we need to rebuild are just there in no time.
Joseph, have you got some thoughts there? Are you seeing a little bit of that strain and people that mightn't have stepped up before getting more engaged in their community, getting more engaged in the social aspect and that compassionate aspect of their faith?
Yeah, I think it's going one of two ways, if I'm honest. I think there's people that are really seeing this as an opportunity to lean in and think about how to almost bring their altruistic self to this virus and to think about how to offer as much as they possibly can to their fellow brothers, sisters, to steal one of Ahmed's favorite words, cousins. How can they bring the most of themselves to the people that are around them? But equally, there's also a lot of people that are incredibly challenged by this. And I think Dr. Fizzell touched on it before. They're withdrawing, they're going into their shell. They're thinking about, some are in a really good frame of mind in terms of this is what I need to do to be safe and secure. Others are thinking this is actually what I need to do just to survive. And so it has the opposite effect. And I'm sure whether you work at Multicultural New South Wales or the Department of Health or even at the ABC, Philippa, this virus, you're seeing the best of people, and you're also seeing some of the more challenging parts of people where you think, really, that's your take and that's your perspective on this. And I think no different in that.
Don't get me started.
Yeah. Oh, it was interesting. I was having this conversation. Yeah, I was having this conversation with another very, very prominent leader within the media space earlier today, just before this call. And he was saying, I'm seeing the best of some of my staff, and unfortunately I'm seeing the opposite to that. And I think it's a really important time because there are so many different angles and so many different voices that are trying to use this pandemic to push their own regime, that we have to, as a society, stand united, that we have to deal in facts, that we have to allow the democratic values of our country to bring us together, that we can't use ethnicity or race or religion as anchor points to be able to divide us. And so I think even the power of this religious forum that we've concentrated so much of today's discussion on, it's not about the religion. It's about different perspectives and different views coming together for the common good to keep New South Wales as safe as we possibly can and as connected as possibly can, and to make sure that the most vulnerable people in our communities, regardless of their religion, whether they're elderly, whether they've got a disability, whether they're battling unsafe home environments, are connected and feel safe. And I think it's bringing out the best of humanity in that respect.
I agree with you, and certainly in my workplace it is, and certainly in the streets the kindness is. I've been travelling a lot over regional New South Wales with, as part of my work with an essential worker letter, but the conversations I've had just blow me away. People's kindness and their compassion to their fellow human being, and it's wonderful. It really is. I think that I'm certainly fortunate enough to see really some of the best of humanity at the moment. So I think we better go to our final video, but hopefully definitely not our last question, from Reverend Simon Hansford, the moderator of the Uniting Church for New South Wales and the ACT.
Good evening, my name's Simon Hansford and I'm the moderator of the Uniting Church in New South Wales and the ACT, and I want to say how much I value interfaith community and conversation. My question is related to the fact that so much of interfaith is built around physical face-to-face, a shared meal, a shared conversation, and I want to ask how we can grow new interfaith, create new interfaith communities and conversations in this COVID time when so much of what we're saying and doing is on video. I want to ask the question about how we can build relationships when we're distanced physically from each other, and how sharing a meal now becomes more a token gesture than a real one. Thank you.
It is hard, isn't it? Because a lot of people I know in an older demographic, they're not comfortable with some of the platforms like this one tonight or Zooming. They've just not got the technological know-how. It's something that's alien.
I'll have a
Joseph.
crack first, Jan. Philippa, I don't think there is a substitute. I don't think that there is anything like giving someone a hug or singing in a choir with someone or, sharing a meal around a table with no social distancing and being able to hug them and handshake them and, do all of those things. I think we're humans. I think fundamentally we are community belonging beings. And I think that's one of the greatest things that this virus has taken away from us is that innate human bond and interaction. And my great fear is that we don't go back to handshaking each other once this virus is done, that we don't go back to hugging each other quite freely, that we don't go back to standing far too close to each other in those pubs and clubs and bars and even at the end of church where we stand far too close to each other. My hope is that we do get back to normal at some stage. And the other thing, though, that I want to say is that I think it's taught all of us a really important lesson. Now, whether that's about flexible working environments, the fact that everyone doesn't need to be in the office, and what opportunities that might create difference in terms of greater levels of inclusion now that we've got this new sense that you don't have to be all on the same space to be able to work together really well. I think the other opportunity is now that more and more people will have, when we hopefully go back to normal, both services that are face-to-face, but also live streams. And what opportunity does that provide for people that might be disconnected or might be in a rural or regional location or might be in a different part of the world but can still now connect back to their familiar parish or church or temple and hear the same voices from, the reverend or the priest or whoever it is that's talking to them. And I think that's incredibly important. And so there's some things out of this virus that I think hopefully will keep. But my great hope is that Dr. Jan and the team at New South Wales Health fix all of our health issues and that we get back to hugging each other and kissing each other and holding each other and sharing a meal. And I just hope that's soon. But I'm also realistic. It might not be, but my great hope is that it's not too far away.
Well, you mentioned the streaming, but there are some faiths that don't really, that's not something they're allowed to do, though. Could you talk a little bit about that?
Yeah, I think, Philippa, you've clearly done your homework. So for some of our more traditional, orthodox or conservative faiths, live streaming for them isn't an option. And that's really important to acknowledge that for some of them, they've been completely disconnected from their place of worship. For many of our most traditionalists in terms of how they view their religion, it is not appropriate to live stream. So for them, they've made massive sacrifices during this really difficult time. And we've seen in some of the other international communities, even big cities like New York, where people have gone against the rulings of the city or the state government or the federal government and still practice their religions. And we've seen that have disastrous consequences to people's health and ultimately human life. And one of the things that I've got great admiration for all of our New South Wales religions is that even in the most difficult times, they've listened, they've taken on board the guidance, and by and large, they have been exceptional in terms of adhering to their guidelines. Now, no, we haven't been perfect, and there's always areas that we need to improve, and we've got to continue to make sure that we champion this messaging. And if there's instances where people are breaching the guidelines, people like Dr. Jan and I need to know so that we can work with those communities in the first instance and the second instance, and then fundamentally help them understand the risks that their behaviour or the breaches of their behaviours in terms of what they're creating is having to the very lives that they're trying to empower and inspire and keep safe. And once they get an appreciation for that, in most instances, those practices and those behaviours have changed very quickly.
Dr. Jan, many people are listening to news from overseas and listening to safety advice from families and friends from their home country. Why is it important for the community to listen to the health information here, the health information from New South Wales Health, Multiculturalism New South Wales?
So I think one of the big challenges is that Australia has been constantly in a very different position to most of the other countries in the world right pandemic. Either we had cases when other countries weren't acknowledging cases, or we are now in a better position and everyone thinks that we must be lying to actually be in such a good place as we are at the moment. And so it makes it also a sense of fatalism in some countries overseas where we tried to do something and things did not work for us. So it can't possibly work. So why would you stop me from doing the things that I want to do? So it's very tricky because we are actually in a very privileged position here in Australia. We have had an incredible response from the community and from my colleagues in health, but it's not just health. It has to be the community. If the community is not on board, none of this works. You know, if people decide that we don't trust the information that you're giving us, we don't trust the reasons why you're asking things of us, then we lose the community. And when we lose the community, COVID spreads. COVID just loves being right in the middle of our human interaction. So as Joseph and I have said many, many times, when we come together, when we hug each other, when we share a meal, this is where COVID likes to get right in the middle of what it means to be a person and what it means to be a community. And so if we lose that trust with that community and people say, it doesn't matter what I do, it's going to get me, or if we say, you know, we need you to do these things, and they say, well, you're not going far enough. You must stop everyone from doing everything. We don't trust those people over there because they're not listening to you. We need to help the community understand that, you know, some things are actually permissible and that some things are a reasonable thing for people to be doing at the moment. So it runs both ways. Sometimes we were running with the community to say, no, actually, no, please don't be doing that. It's really a bad idea. But other times we're saying, actually, it's okay, it's safe. You can go and do these things again. We just have to do them differently at the moment. And I think that's where we've had this strength in Australia, where people have actually worked with the government, where it's trying people now because, you know, we sort of get to a good point and it goes again. But what I'm really excited about in New South Wales, and I'm touching the Laminex here at the moment, but what we will probably see for the next little while are what, rather than a wave, hopefully we'll see ripples. And so what we'll see is we'll start to see a little bit of community transmission bubble up from wherever it's hiding out there at the moment, and then people will self-regulate. We didn't need to put in the hard restrictions this time. We didn't need to close the churches. We didn't need to do many of these things because people naturally self-regulated. And because people trusted those messages from earlier on, we didn't need to put the same level of restrictions in place this time because we managed to convince the community to work with us, and we managed to get this, you know, hopefully we're getting back to where it's just bubbling and we'll have the 1 to 2, 1, 2, 0, 1, 2s again. And while ever we've got the community coming forward and trusting that when we test them, we'll get back their test results to them quickly, that when we ask them not to go to work, we'll give them a good reason, that when we ask them to change their practice at church or at the temple or at the mosque, that we will remove that restriction as soon as it's safe to do so. Whilst ever we keep that dialogue going with the community, that we are reacting not just to the disease, but also reacting to what people are willing to do for themselves, it means that we're in a much better place as far as not having to, you know, slam things shut. We can just sort of hopefully just keep it, you know, keep us able to do things, maybe not the way we'd all love to be doing them, but keep doing things gently, slowly. And if we do see a little rise again, we know that if the community responds in the way it has this time, we'll be able to get it under control again. So hopefully what we'll see is no waves, but just ripples. And even no ripples would be great, but realistically,
even no
we may see
ripples.
ripples.
Well, I suppose
It'd be nice,
I'd like to bring you both in, and Joseph, just has there been any resistance to the requirement to modify traditional religious practices? Are there some frontiers that still need ironing out? And Jan, you might like to add to Joseph's remarks there.
Yeah, yes, there is, Philippa. It's a constant task, and I think you touched on it before. So many people are consuming media from different sources. We live in a global media landscape. As Dr. Fizzell really rightly said, We need to listen to the advice that is Australian specific and especially New South Wales specific. I have some great privileges in my life that none of my other family members or my friends from Melbourne currently enjoy. Now, if I'm consuming Melbourne media, then I'm not doing what I need to be in New South Wales. And so it's super important that they listen to the advice from New South Wales Health, from the New South Wales government, to understand the specific messages that are the right and balanced approach for New South Wales right now. And it's also incredibly important that our religious communities, as much as Dr. Jan talks about it as ripples, it will be a wave unless we adhere to that advice. It will be a wave if people start to breach the requirements or start to lose trust in terms of the process that needs to be followed. This can't be something government does alone. It has to be done in strong partnership with our community leaders, our religious leaders, every leader within the community, and with the support of the government in terms of making sure that there's no barriers to accessing this information through language, or no barriers to accessing this information in terms of geography or distance or any of those sorts of things as well.
And Dr. Jan, your final thoughts.
Look, I think we wouldn't be in the position that we are if we hadn't built this strong ability to communicate swiftly and to receive feedback from our religious leaders in New South Wales. It's been one of the great privileges of this response for me to be able to work with so many amazing people who have the best interests of so many people in their hearts, and to be able to explain what we're doing and why, and to answer questions of what can seem unreasonable requests. And it has just been a huge privilege to be able to be part of this, and we couldn't be in the situation we are here in New South Wales without them. It's just been a magnificent response from the many different leaders who have worked together, who've asked the same questions in their own different settings, but who've taken the information and that sort of shared yearning for a more normal and different life than what we have, but to sort of address the fact that people's spiritual needs are just so fundamental to their well-being, and there is no health if we're not well as people. And so I think the ability to show that as New South Wales Health, to have that privilege of working with religious leaders to show that we do understand that health is not just about controlling an infectious disease, it is actually looking after the total package of people, has been a real privilege for me. And I'm very thankful to Joe and his team for allowing me to work so closely with them to be able to work with the community.
And I just, maybe on a personal note to you both, if you don't mind, people see you as incredible leaders in this time of crisis. They probably don't even see you as human beings, but if you just give us a sense of what motivates each of you personally.
I am incredibly lucky to have a job, and I've got a job that has a really clear purpose. And as I say to my 2-year-old son every day when he says, "Are you going to work?" I say, "I'm going to work." And he says, "Are you going to help?" And I say, "Yes, I'm going to help." And that is my job. My job is to help make sure that every person that doesn't have a voice in this equation, or every person that has barriers or issues within the culturally diverse communities and all communities of New South Wales, has a chance to be able to feel supported and get access to the key services that are available to them.
Dr. Jan.
How do I follow that? I think the key thing that I'm most excited about is being able to help people during this really difficult time. There's nothing normal about any of this. I have a family. I have, my dad's in aged care. My mum's elderly. My son is one of those 20-year-olds who's having a hard time. My mother-in-law and father-in-law going to church every day is fundamental to their way of being. So knowing that all of these people in my life are just as impacted by everything we do as every other member of the community means that I have a responsibility to them as well as to everyone else, not just to my family, of course, but to the whole community, to be able to try and help. This is not what I have ever done before. I'm always the person behind the scenes helping other people with their messaging. This is not what I thought I would be doing during the pandemic. Last pandemic, I sat quietly and got through stuff and made things work for the comms team. This time they've put me out front and centre. So it wasn't what I was looking to be doing. But as I said, it's an immense privilege to be able to work with such amazing people, to be able to help protect people in New South Wales and to be able to make it a little bit better for them. And so I'm very,
thank
very
you,
glad to be able
Joseph.
to do that.
Thank you, Joseph. Thank you, Dr. Jan. We're in awesome hands, and it's been an absolute privilege to be part of this discussion and to speak with you both. And now we're joined by the man who's made tonight possible, Affinity Intercultural Foundation CEO, Ahmed Polat.
I don't know if we can hear our cousin, Ahmed.
Oops.
Philippa, I think he's saying you did a wonderful job.
Yes.
Comparing this session. Dr. Jan, thank you for your very unique and important insights. Joseph, keep doing the good work that you're doing, my cousin. I want to see you more at the next dinner. But
I'm out of a job, Joseph. Well, look, let's wrap up on behalf of Ahmed Polat and the Affinity Intercultural Foundation, and a very big thank you to our special guests, Dr. Jan Fizzell and Joseph La Posta. And please join us next Wednesday night for another COVID-19 special health report and facilitated forum. And I'll look forward to seeing you next week. Thank you so much.